Hyoid bone fracture classifications: inward compression fracture, anterior posterior compression fracture, and avulsion fracture. Hyoid bone is lies at the root of the tongue where the body is difficult to feel. The greater horns lies behind the front of the sternocleidomastoid, 3 cm below the angle of the mandible and 1.5 cm from the midline. Okay, 3 cm from the behind the front part of behind the angle of the mandible and 1.5 cm from the midline. Next is inward compression fracture. This is in case of throttling, where the main force is an inward compression acting on the hyoid bone. The finger of the grasping squeeze the greater horns towards each other, due to which the bones may be fractured within 1 cm. The tip and posterior fragment is displaced inward. Periosteum is torn outer side of the bone but not on inner side. In such cases, the body of grasped in one hand, the distal fragment between the finger and the thumb of the other hand, distal fragment can easily bend in inward direction, but outward movement is limited to the normal position. At the joint between the greater horn and a body of hyoid, a similar fracture may be seen. In some cases, bilateral fractures may occur. In cases of putrefaction and macerations, the soft tissues are not attached to the bone. It is difficult to say whether the small fragment was fractured inward or outward. The bone should be preserved with the soft tissue attached. It has to be kept at an exhibit. Next is anterior posterior compression or fracture, subduction fracture. In cases of hanging, the hyoid bone is forced directly backward, due to which the divergence of greater horn is increased, which may fracture with outward displacement of the posterior small fragment. In such cases, a periosteum is torn in inner side of the fracture only, due to which the fragment can easily pass. Due to which the fragment can easily move outward, but inward movement is limited to normal position only. Like in inward compression fracture, anterior posterior compression fracture may occur either in greater cornua, either in greater horns, or in junction with the body and the bilateral. When compression is severe, a small fragment compression is when the compression is, the small fragment completely detached from the bone, may be either medially or laterally or rest of the bone. In such cases, in situ examination of the hyoid bone in the neck only will decide whether the fracture was inward or outward. The outward fractures of the greater horns of the hyoid bone are seen in ligature strangulation, run over or motor vehicle accidents, blows on the front of the neck. In these cases, a hyoid bone is gradually fractured with outward displacement of the fragment, and multiple fractures of other are also found. Some cases, bilateral hyoid bone fractures of hyoid bone hanging. One horn is fractured outward and other inward. This may be explained in follows. Hyoid bone is pressed backward as well as move from side to side, from due to which the posterior horn of the greater cornua may caught against a bony ridge or ridges of the vertebrae, and inward fracture of the imprisoned greater cornua occurs because of the continued side to side movement, and a counter pressure on outward fracture of the greater cornua due to the further compression of the vertebral column. Next is inward compression or anterior posterior compression are not much practical value. Next is avulsion fracture or tug or traction fracture. The violent or lateral downward movement of the thyroid cartilage or the pressure between the cartilage and the hyoid bone will produce traction through thyrohyoid ligaments, leading to fracture of the hyoid bone. Demonstration of the fracture. 1% aqueous solution of toluidine blue applied to suspect area fracture and left for 15 seconds, then cleaned with water. By examination, stereo microscope fracture site may appear as a bluish. The cartilaginous separation between the greater horn and the body and the joint between the lesser horn and the body, or the presence of incomplete union of the hyoid part, should not be mistaken or fracture. Triticatious cartilage are little nodules embedded in the thyrohyoid ligament. This may be confused with a fracture of the superior horn of the thyroid cartilage. They are normal in anatomical vein and can be palpated as nodules and easily moved in different direction. Improper dissection of the neck may produce postmortem fractures. The neck should be x-rayed in lateral position to demonstrate the fracture of the hyoid and cricoid. Thank you.